Hi, I'm Dr. Rebecca Daniel, a physician at St. Joseph Mercy Health System, and I'm here to provide you with education about anticoagulant medication. Taking an anticoagulant is a very common and normal part of one's health. Please use this video as a tool to learn how to live well and healthy while taking your anticoagulant. We'll cover how an anticoagulant works, the directions you need to follow, when to call your doctor, and some of the side effects and precautions for these anticoagulants. This video will be available to you online 24 hours a day. Feel free to watch it more than once. Your health depends on getting it right. Anticoagulants are used to prevent harmful blood clots from forming or moving in your body. When you cut or scrape yourself, your body forms clots to stop excessive bleeding. These are the good clots. Some blood clots are bad and can cause blockage in your bloodstream, which can lead to deep vein thrombosis or even strokes. The goal with anticoagulants is to maximize the ability to form good clots while minimizing the ability to form the bad ones. It is very important for your health to take your anticoagulant every day as prescribed by your doctor in order to keep the right balance between the good clots and the bad clots. But we all get forgetful sometimes, so let's talk about what to do in case you forget to take a dose of your anticoagulant. If you forget to take your anticoagulant, you may take your dose later, up to a certain point. For example, if you take your anticoagulant once a day, you may take a missed dose up to 12 hours past the time you usually take it. If you take your anticoagulant twice a day, you may take a missed dose up to 6 hours past the time you usually take it. If you miss a dose and are past the time to take it, do not take 2 to catch up. This is not safe and makes it more likely that you could have problems with bleeding. Continue with your regular dosing. Now we will review the safety information you need to know when you take an anticoagulant. First, let's talk about situations when you need to seek medical attention. If you experience unusual symptoms that are new since the beginning of anticoagulant therapy, call your doctor. Call your doctor or go to the emergency room if you notice bleeding that doesn't stop, like from a cut or from your nose. Inform your doctor if you notice bleeding when you brush your teeth. If you are a female of childbearing age and miss a period or become pregnant, call your doctor. Inform your doctor if you notice more bleeding than usual during your menstrual period or any other vaginal bleeding outside of your cycle. If you notice blood in your urine making it pink to dark brown, blood in your stool which makes it appear red, black, or tarry, vomit that looks bloody or like coffee grounds, unusual bruising, black and blue marks on your skin for unknown reasons, fever, sickness, severe diarrhea, or vomiting for over a day, call your doctor. Also, if you are going to be away from home for an extended period of time, inform your doctor. He or she may have additional instructions for you to follow. If you experience any dizziness or confusion, rapid or unusual heartbeats, shortness of breath, or chest pain, severe pain or swelling in any part of your legs or feet, go to the emergency room. Now, this is very important. If you have a serious fall or hurt your head in an accident, go to the emergency room immediately. Even if you feel fine, it's important that you be examined right away because serious bleeding in the brain may not appear for hours to days. Yes, that's a lot to remember, but we want you to be safe. Make sure that your families and companions are also aware of when to call the doctor. Remember, you can always replay this video for more information. Okay, so we've gone over when to seek medical attention while you're on an anticoagulant. Now let's talk about some of the precautions you need to take while on an anticoagulant. Because an anticoagulant may lead to excessive bleeding, you may have to make a few small lifestyle changes to keep safe. In case you cannot respond in an emergency, I recommend wearing a medic alert bracelet or carrying information telling healthcare providers that you are on an anticoagulant. Brush your teeth with a soft toothbrush to avoid scratching your gums. Be careful with floss. Inform your dentist, hygienist, or any other healthcare professional that you are taking an anticoagulant. Inform your prescribing doctor if you are planning any dental work or surgery. Use an electric razor for shaving rather than a blade razor. Avoid scratching your skin so that you don't break the surface or irritate it. Wear gloves and long sleeves when gardening, and be careful with the gardening tools. Be careful when you're using knives, power tools, and everyday items when working around the home. Always wear shoes or slippers to protect the bottom of your feet. Never trim corns, calluses, or nails with a sharp knife or razor blade. You should also avoid climbing on ladders, walking on slippery surfaces, and activities that require a helmet. If you're interested in participating in a contact sport like football, please discuss this with your primary care physician. Avoid alcohol. Alcohol increases the risk of stomach problems, like gastritis, which is irritation that can lead to bleeding from the stomach. Let your doctor know if you start smoking or change your smoking habits. Thanks for watching and learning more about your anticoagulant. Please feel free to watch this video more than once if you need a reminder on everything we've covered. If you'd like more information, please refer to the printed materials that were provided to you or give your healthcare provider a call. If the anticoagulant you're taking is called warfarin or Coumadin, please continue to the next section. The anticoagulant you will be taking has two names, like all medications. The generic name is warfarin, and Coumadin is the brand name. Warfarin and Coumadin are referring to the same anticoagulant medication. For the purposes of this video, we'll use the term warfarin. The way we determine how much warfarin is in your system is by a blood test called an INR. Basically, the INR test determines how long it takes a clot to form from your blood. Your INR goal will be between 2 to 3 or 2.5 to 3.5, depending on why you are taking warfarin. If the INR is too low, it can increase the risk of a bad blood clot. Alternatively, if the INR is too high, it can lead to excessive bleeding. The key to the effectiveness of warfarin is finding the right dose that keeps your INR within your range. This may mean more frequent testing at the beginning of treatment or when your medical conditions change. Your INR can also vary if you make drastic changes to your lifestyle, more or less exercising, major changes to your diet, so this is also why frequent testing and close monitoring is important. So, throughout your treatment with warfarin, we ask for your compliance, we ask for your patience, and we ask that you help us help you to get your INR set correctly. To accomplish this, there are several things you need to do. So, over the next few minutes, I'm going to share quite a few very important reminders. When you pick up your prescription, always verify that you have the right dose and number of tablets. The color of the tablet should remain the same unless the warfarin dose changes. Always take your medicines at the same time every day and only take the amount prescribed. It's preferred that you take it in the evening, but being consistent and not missing a dose is the most important. So find a time that you can stick to each day and try not to forget. If you forget to take your warfarin, you may take your dose up to 12 hours past the time you usually take it. If you forget to take warfarin by more than 12 hours, make a note of it in your calendar or your journal and call your doctor or clinic, even if you don't feel any different or notice any unusual symptoms. You can take it with or without food, and you can take it with other medications you've been prescribed, as long as you've gotten the okay from your doctor or pharmacist to take them while on warfarin. You'll need to keep track of your warfarin intake by using a calendar or journal. Some people refer to this as their warfarin calendar. Always keep your appointments and stick to your INR test schedule so that your doctor knows your INR and can adjust your warfarin dose to keep your INR in your goal range. Tell your medical professionals about every medicine, supplement, and herbal remedy that you take. This includes any over-the-counter medications. Some of these medications will interact with warfarin and have an undesirable effect on your INR and your health. Your doctor or pharmacist can provide you with a list of products to avoid while taking warfarin. Some over-the-counter drugs and supplements are okay to take, but only your doctor or pharmacist can tell you what's okay. So please don't take anything outside of your regular dose of warfarin unless you have an A-OK from your doctor or pharmacist. Now let's talk about your diet. This can have a dramatic effect on your INR and warfarin's effectiveness. You'll want to eat a consistent and well-balanced diet that's high in fiber, including fruits, vegetables, and whole grains. Vitamin K in some foods can decrease warfarin's effectiveness. Therefore, you need to be aware of foods that contain vitamin K. Vitamin K is typically found in healthy foods like green leafy vegetables. Think spinach, romaine, kale, broccoli, asparagus, Brussels sprouts, cabbage, and cucumbers. Herbs and spices with high vitamin K content include basil, sage, thyme, cayenne pepper, paprika, and curry. Oils with high vitamin K content include canola, soybean, and olive. The key with consuming vitamin K foods is moderation and consistency. Consume the same amount of vitamin K foods each day and each week. It's healthy food, so don't avoid it, but be consistent. Eating more vitamin K than your usual will cause a low INR. Eating less vitamin K than usual may cause a high INR. We don't have time in this video to go over everything you need to know about making good choices when it comes to food, so we'll provide you with a few written guidelines. As always, if you have any questions, contact your doctor or pharmacist. Let's talk about the side effects you may see as a result of taking warfarin. If you've been paying attention, and I hope you were, you may have heard me say a time or two that you are more prone to bleeding for a longer period of time as a result of taking your warfarin. If you do have an accident, treat your cut with pressure and a dry, clean cloth or gauze. If the bleeding does not stop, call your doctor, or, if severe, go to the emergency room. You may notice you bruise easier than before. If you notice excessive bruising, contact your doctor. Other uncommon side effects include hair loss, nausea, vomiting, cramping or diarrhea, dizziness, or fatigue. Thanks for watching and learning more about your anticoagulant. Please feel free to watch this video more than once if you need a reminder on everything we've covered. If you'd like more information, please refer to the printed materials that were provided to you or call your healthcare provider. On behalf of the physicians and staff at St. Joe's, we wish you well on your healthcare journey.